Skipping your exercises in the first 6 weeks after knee replacement can affect your mobility for decades. Once the scar tissue forms, the motion you didn't gain becomes extremely difficult to recover. But the right exercises early on can unlock motion that lasts the rest of your life. In this video, I'll show you exactly which exercises maximize your knee's range of motion, how to perform each one, and common mistakes to avoid. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a board-certified orthopedic surgeon who specializes in hip and knee replacements. I've guided thousands of patients through this recovery, and the reality is that while most people get excellent motion, some people are stuck with permanent limitations. The difference? It's often the exercises that are done, or not done, in that 6-week window. Quick terminology that you'll hear. Extension means straightening your knee, flexion means bending it. And like any exercise program, check with your medical team before performing these yourself. We'll start with extension exercises, and the first one, known as heel props or knee extension stretches, is absolutely critical. Heel props are your extension workhorse. Improved motion doesn't come from short, aggressive stretches. It comes from long periods of time under tension. Heel props are a low-load, long-duration stretch that allows the soft tissues behind your knee, like your hamstrings and posterior capsule, to gradually lengthen. Prop your heel on a rolled towel or cushion, either while lying in bed or with your leg elevated on a chair, making sure nothing supports your knee. Let your knee hang freely in the air with gravity working to straighten it. You should feel a moderate stretch in the back of your knee. Work your way up to holding this position for 5 to 10 minutes at a time. Don't place a pillow or other support under your knee. This defeats the entire purpose by keeping it bent. The second mistake is stopping the stretch too soon. You need long periods of time to allow the tissue to stretch and remodel. Think of this like slowly stretching taffy rather than yanking on a rubber band. Start these immediately after surgery. Aim for at least 3 sessions daily, working your way up to 10 minutes each. Do this while watching TV, reading, or even eating. The beauty of heel props is that they don't require active effort, just time and consistency. Now that you've seen the first exercise, I need to explain why I'm starting with extension rather than the flexion exercises that most people expect. Extension, which is, again, your knee's ability to straighten, is just as important and arguably even more important than bending early on in the recovery. This might surprise you because most people focus on bending, but here's why extension needs to be a priority. A knee that doesn't come at least close to fully straight can create serious problems. It can cause a limp, extra strain on your other joints, and pain at the front of your knee. To make things worse, big deficits in extension become extremely difficult to fix once the scar tissue has formed. Another thing to know is that procedures like manipulation under anesthesia are sometimes done after knee replacement to improve range of motion, but this tends to be more helpful for improving flexion and not as helpful for improving extension. Now, this isn't to say that you should ignore flexion, because both extension and flexion are critical for healthy knee function. But because even small extension deficiencies can cause big problems, and because big extension deficiencies are harder to treat than big flexion deficiencies, work hard to maximize extension early. Now, gravity can pull your knee straight with heel props, but that's only half the battle. Your muscles have to actively keep it there when you're upright, and that's what we're strengthening next with quadriceps sets. Your quadriceps muscle is the main driver of knee extension. When this muscle fires properly, it pulls your knee straight and stabilizes your kneecap. Patients with weak quads struggle with walking and can't maintain full knee extension because the muscle isn't doing its job. Recovering this muscle early prevents compensatory movement patterns and makes recovery much smoother. Lying flat with your surgical leg straight, contract your thigh muscle hard enough that you feel your knee press down into the bed. With practice, you should be able to feel your thigh firm up. Hold this maximum contraction for 5 to 10 seconds, then release completely. The full relaxation between reps is just as important as the contraction itself. Don't fake the muscle contraction. You should feel your knee straighten, and you may be able to see your quadriceps muscle get tense. If you're just thinking about tightening and not getting visible results, you may not be engaging the muscle properly. Try to avoid recruiting your hip or glutes to help. This should be isolated quad work. And remember, full relaxation between each contraction allows for a stronger contraction the next time. Start these right after surgery and do them frequently throughout the day, about 10 reps every hour or two while you're awake. The goal is a high volume of repetitions. These frequent, repeated contractions are what retrain the connection between nerve and muscle that the surgery temporarily disrupted. Quad sets wake up the muscle. Now let's build actual strength with straight leg raises. Straight leg raises strengthen the quadriceps muscle even more than quadriceps sets. And again, a stronger quadriceps muscle means better extension control, which means that you can straighten your knee and keep it straight with actual muscle power. Start by mastering a solid quadriceps set with your leg flat. While you're performing this, maintain that contraction and lift your entire straight leg until your foot is about 12 inches or 30 centimeters off the surface. The knee must stay locked throughout. Hold the top position briefly, then control the descent. You can keep your non-surgical knee bent to protect your lower back from strain. The most common error is the knee involuntarily bending during the lift. We call this an extensor lag, and it means that your quadriceps isn't strong enough to do the exercise properly yet. If your knee starts bending during the lift, go back to quad sets and build more strength first. Don't compensate by hiking your hip or arching your back. The movement should be smooth and controlled from the thigh, not driven by momentum. Try these immediately after surgery, but don't be surprised if your quads are too weak in the first several days. Once you can perform these without your knee bending, do 1 to 3 sets daily. Start with just a few reps, but work your way toward 10, 15, or even 20 reps as your strength improves. Focus on proper form over high numbers of repetitions. So you've built strength and motion lying down. Now here's how to turn them functional for standing and walking with terminal knee extensions. Terminal knee extensions build active control in the final degrees of extension, that crucial range where your knee locks out straight. This helps prevent your knee from buckling when you walk. Since the exercise is done in a standing position, it's also a more functional exercise, meaning that it carries over better to normal daily activities like standing and walking. Once you can stand comfortably, stand with your surgical knee slightly bent at about 30 degrees. Keeping your heel planted on the ground, straighten your knee fully, contracting your quadriceps hard. Hold this fully straightened position for a few seconds, feeling both the quadriceps contraction and a stretch behind your knee. Then slowly return to the starting position. This is a short arc movement focused entirely on that final straightening, so it's intentional that not much movement is going on here. As you progress, you can secure a resistance band in front of you and loop it around the back of your knee. This provides added resistance and strengthens your quadriceps even more. Don't lean your body forward or backward to help. The motion should come purely from your knee straightening. Keep your torso stable and isolate the movement to your knee joint. If you choose to add a resistance band for progression, make sure the band is positioned at knee height, not too high or too low. The resistance should be challenging, but not painful. If you can't keep your heel down or you're compensating with your whole body, the band may be too strong. Use lighter resistance or practice without the band first. Start these when you can stand comfortably for a few minutes, or around the 1 to 2 week mark. Perform 2 to 3 sets of 10 to 15 repetitions and do this once or twice daily. And again, you can add additional difficulty with a resistance band as you get stronger. So you've worked hard on extension, which helps prevent serious problems. But flexion undeniably enhances your function. Getting in and out of cars without contorting yourself, sitting in a restaurant booth without your legs sticking out, climbing stairs without that awkward step up. You need flexion to do these things, and even more. And these next exercises are designed specifically to get you there, starting with heel slides. Heel slides are your foundational flexion exercise. Unlike aggressive stretching that can cause inflammation and set you back, heel slides rely on frequent, controlled repetitions. While lying on your back, slide your heel toward your buttock, bringing your knee into as much flexion as you can reasonably tolerate. Hold the deepest bend for 5 to 10 seconds, then straighten your knee. At the end range of motion, you can loop a towel or strap around your foot to provide gentle overpressure, pulling just enough to feel a moderate stretch, not pain. Don't let your foot come off the floor. You aren't bending the knee so much as you are flexing the hip by doing this. It's also normal to have some discomfort with this exercise. Totally avoiding discomfort means you probably aren't stimulating enough progress, but you also don't want to overdo it. Repeatedly overinflaming the knee slows your progress as well. Find the line between discomfort and sharp pain and stay just below it. Start these right after surgery. 3 or more sessions daily with about 10 repetitions each creates consistent progress. The cumulative effect of multiple sessions daily is better than a single aggressive stretch. Heel slides lying down are your foundation. but most of your life happens sitting or standing, not flat on your back. That's why this next variation matters. Seated heel slides offer a functional progression from the supine version. The seated position mimics real-world activities like sitting in a chair or getting up from a seated position, making it even more relevant for daily life. Sit on the edge of a bed or in a firm chair with your feet flat on the floor. Slowly slide your surgical foot backward under the chair or bed, bending your knee as far as you can reasonably tolerate. At your end range of motion, you can use your other foot to gently assist. You can also scoot your buttocks forward for a deeper bend. Hold for 5 to 10 seconds at maximum flexion, then slide your foot forward to straighten. Don't let your hips slide forward off the chair to fake more knee bending. Your torso should stay upright and stationary. Keep your foot tracking straight rather than angling outward. Avoid using explosive, jerky motions to force the bend. These can also be started right after surgery. Try doing 2 to 3 sessions daily with about 10 repetitions per session. Once you've mastered both heel slide variations, wall slides offer a change in position to maximize your flexion even further. Wall slides provide a great end range stretch for flexion. They're especially useful once you've already achieved about 90 to 100 degrees of flexion and you're working toward deeper bending. Wall slides also take advantage of gravity to improve your knee flexion, which can help improve your range beyond what your effort can accomplish alone. Lie on your back near a wall and place your foot on the wall. Let gravity slowly slide your foot down the wall in a straight path. If your foot stops sliding before you reach the point of some discomfort, you can use your other foot to help you if needed. Hold for about 10 seconds, then slide your foot back up the wall. Don't deviate left or right with your foot as you slide down. Avoid rotating your hip to the left or right as well. Try to keep your foot path straight up and down, and keep your knee lined up with your foot. Once you can reliably do supine and seated heel slides in the 90 to 100 degree range, add wall slides to the regimen. This is usually within the 2 to 4 week mark. Try 10 reps once or twice daily, then gradually add more sessions as tolerated. All these exercises can be done with little to no equipment, but there's one piece of equipment that combines stretching, strengthening, and cardio all at once. If you have access to a stationary bike, it can be a game changer. The bike is excellent for range of motion because it combines light resistance with repetitive motion. It's also great for cardiovascular fitness as you recover. The smooth circular motion helps you work through stiffness without the impact of your body weight on your knees. Start with the seat raised high, so that your knee does not have to bend excessively right from the start. Keep the resistance setting minimal, and rock the pedals back and forth as far as you can without much discomfort. Early on, you may not be able to make full rotations with the pedals, and that's okay. As flexion improves, you will eventually be able to make a full rotation. As your motion improves even further, you can lower the seat gradually to create even more knee flexion with each pedal stroke. Don't set the seat too low initially. This can force too much knee flexion early, which can overinflame the knee. Lower the seat height gradually as your flexion improves. Start with minimal resistance and focus on smooth motion, not power or speed. Surgeons often allow using a stationary bike once you get to about 90 to 100 degrees of flexion, or about 2 to 4 weeks. Using it once or twice daily for 10 minutes a session is a good place to start, especially once you're able to make full rotations. Before we wrap up, let's do a quick recap on when to start each exercise. You should always confirm this with your surgical team first, since not every surgeon's protocol is the same. Heel props, quad sets, and both versions of heel slides can typically start right away. Straight leg raises are also fine to begin immediately, but don't be surprised if your quads are too weak for the first few days. That's normal. Terminal knee extensions can be added once you're able to stand comfortably for a few minutes at a time, or around 1 to 2 weeks. Wall slides and the stationary bike usually come into play once you've reached about 90 to 100 degrees of flexion, or around the 2 to 4 week mark. The key is to build gradually. Start with the basics and layer in more advanced exercises as your motion improves. I won't sugarcoat things. I know that for most people, the rehab is one of the most challenging parts of the recovery. If you can stay consistent though, the payoff is huge. The patients who treat their rehab like a part-time job during this time frame end up with the motion they need for the rest of their life. If you'd like to know what your range of motion timeline should look like after surgery, as well as what other strategies you can use in addition to your exercises to unlock your knee's range of motion, I'll put my video on that right here. Next, I'll also post a video that covers exactly how much motion you need for daily activities, like putting your socks and shoes on and squatting down. Once that's ready, I'll put it on screen right here. If you found this helpful, please click the like button. It helps other people find this information when they need it. Stay well, and I'll see you in the next video.